All right, so good afternoon, everyone. My name is Brad Nakamura. I'm a professor in the Department of Psychology at UH Manoa and co-chair of CAMD's Evidence-Based Services Committee. And fun fact, let's make it a fun fact. I have 3 kids, a 15-year-old and 2 10-year-olds. The 10-year-olds are boy-girl twins and never a dull moment. I will pass it on to Lydia.
Hi, I'm Lydia. I'm the pre-doctoral intern at the East Hawaii Family Guidance Center. I'm sick, I'm losing my voice, so Stephanie's going to do most of the talking today, but I'm glad to be here with you all. Earning my PhD. I am almost there, like 1 month till I done with my internship. I have a cat named Brad, and I like to take him on walks. Hope that's not offensive, Brad. We just wanted to name him a human name.
You have a cat named Brad?
Yeah.
That's awesome. That's pretty funny. That's pretty funny. I hope he's not awkward with poor social skills.
He's a great cat.
Oh.
Okay, somebody else could go. Am I supposed to pass it? Tristan.
Okay, hi everyone. Thanks for being here today. My name is Tristan. I'm the current, soon leaving EBS committee assistant. I appreciate everyone's patience and cooperation and getting all of the stuff together for today. And my fun fact, I was in an interview recently, and the question that they asked us is what is your random superpower to help us remember who you are? And my answer to that was I can eat really, really spicy food. I don't know. I think it's cool, but so that's my fun fact. I will pass it over to Christy.
Hi, I'm Christy. I work at DHS. My other half's name is Brad. So there's another Brad. So I've been working with DHS for a while. I have 3 children. So I have the 2 that are adults, and I got a surprise one who is 10. I work in a sex abuse specialized unit at Child Welfare Services. Fun fact about me, I'm kind of boring. I mean, I like to read, I like to write, read, but I love chocolate. I gotta have a chocolate. So how about Andrea? Did you go yet?
No, not yet. Thanks, Christy. Hi everyone, I'm Andrea, and I am I'm going to be the person taking over Tristan's position after she leaves us for internship, her well-deserved time at internship. And then so I'll be the incoming EBS committee assistant. I'm currently still a graduate student. I work under Brad at UH. And my fun fact is that my fun fact is that I speak 4 languages.
That's an extremely fun fact. It's an
thank you.
impressive fact.
Thank you. I think so. I'm originally from Malaysia, so there it's common to know at least 2, and so I think because that is the norm, I am it's regular, but then I so I have to I speak English, Cantonese, Mandarin, and Malay.
Amazing. Have you ever heard of the book What My Bones Know by Stephanie Fu?
No.
Oh, I have to show you how pretty it is. Hold on. I just got it. I just won it at the Wellness and Resilience Summit, but it's this beautiful book. And it's a memoir of healing from complex the memoir from healing from complex trauma. And I mentioned it because she is ethnically Chinese, but lived part-time in Malaysia, and I'm at the beginning and I'm so sucked in. It's so good. But for people who have had significant childhood abuse or trauma, I might not recommend it if they need to still work on some stuff there. So yeah, it's her story and it's very, very, very good. And the audiobook, she says it too.
Oh, that's so good.
But
I love audiobooks. I would definitely
I'm
give
Stephanie
that a listen.
Campbell.
Thank you, Stephanie. And
now
you go next.
My fun fact is I have many things to recommend to many people, I suppose it's related. But the other really mundane fun fact is that I will do almost anything to prevent from having to go back to the car if I'm bringing stuff in. I will like precariously balance a million items as much as I can. I'll stuff it in my clothes. I do not want to go back to the car if I can help.
Andrea's the same way, Stephanie. She once carried so many things from her car, she dislocated her shoulder.
That is slightly altered. I did dislocate my shoulder while carrying groceries. However, I think it was really heavy, but I put everything in the car, and the thing that dislocated it was a bag, and in it was only a box of 6 eggs. That was what did it. That was what actually ultimately dislocated the shoulder. It wasn't when I was carrying like watermelon and all these like super heavy fruits, but it was when I was carrying the eggs that popped it. So.
Sorry, I don't normally disclose my students' PHI, but if there's a joke, I do.
Oh, that's wild. A cautionary tale. I'll think of you next time I'm balancing my too many things.
Yeah.
Coming out of my car.
It's okay, Stephanie. I still do it. I haven't learned. And I was the one that went through it. So it's okay. I still do it.
Any other housekeeping before Tristan opens the floodgates and people come in?
I maybe have one question for Stephanie and Lydia. Will there be some sort of prompt or something in the presentation where you would like me to launch the poll, or should I launch it kind of once we start the presentation?
Oh, good question. I was thinking we could do it. We have a section like right before we do definitions. So maybe when we pop up the like definitions intro, that would be a good time just to see how people are feeling before we define them.
Okay.
Cool.
Is Farah coming as well?
That's a really great question. I only have her email address. I'm going to shoot her one right now. But Christy, if you have her information, like phone number, or if she's like in the office with you.
No, she's in our sister unit.
Gotcha.
Let me check.
I think I might know. What's Farah's last name?
I still cannot pronounce
Canionero?
Canionero.
Okay, maybe it's not the person I'm thinking of. I'm not sure.
Yeah. I think I have it.
Yeah, I'm gonna need to introduce her. I'm just like looking at him.
Yeah.
I'll just ask Andrea. She speaks 4 languages. She can probably pronounce Farah's last name.
There you go.
I'm gonna go get some eggs from my car. I'll be back in 1 hour. All right, 2:58.
I'll go get eggs, and then I'll be like, there's an emergency. I can't do it anymore. I'm sorry.
I think we could let people in.
Okay.
Start wondering.
I'll go back to sharing my
I'm gonna go
screen.
All right, it's so really great to see a lot of people streaming in. Maybe we'll give it another minute before we start with some housekeeping. Okay, kind of easing us in. So good afternoon, everyone. Today we have the pleasure of having Stephanie Campbell and Lydia Hogan presenting on From Empathy to Exhaustion, Recognizing and Addressing Burnout, Compassion Fatigue, and Vicarious Trauma in Mental Health Practice. This is our June edition of the Evidence-Based Services Committee Roundtable, put on by the Hawaii State Child and Adolescent Mental Health Division and done in partnership with various entities throughout the state. This roundtable presentation has been approved by the National Association of Social Workers Hawaii chapter for up to 1.5 social work continuing education units or CEUs. If you're interested in receiving social work CEUs, you must fulfill 2 requirements. Whichever email you use to register for today's roundtable, please be on the lookout for a feedback survey that we'll be sending to that specific email address. Okay, your CEUs will be awarded based on both your time in the webinar today and your completion of the forthcoming survey. You'll be expected to attend at least 90% of today's roundtable webinar to be considered in awarding of CEUs. However, whether or not you have signed up to receive CEUs, we'd be very grateful if you would fill out the forthcoming survey to give us feedback on today's webinar. Unfortunately, CEUs for psychologists are not available for this roundtable today. Other housekeeping, I will first introduce our 2 presenters, Stephanie Campbell and Lydia Hogan. And then towards the end, when they're finishing up their presentation, I will more formally introduce our discussants. Starting off with Dr. Campbell. I think I've known Stephanie only for a little bit, but she seems to have a very good sense of humor. And what I'm about to read is verbatim what Stephanie put in her bio sketch. So just be aware of that. So Stephanie is a half Filipina, small fat cisgender daughter of an immigrant who grew up in a 1-stoplight town in Arkansas. She is a licensed psychologist in Hawaii and nationally certified school psychologist who currently serves as the crisis liaison and community trainer for the Hawaii DOH Child and Adolescent Mental Health Division. Dr. Campbell participates in systems-level interventions for statewide mental health crisis response and develops free training opportunities for community members and providers. Dr. Campbell's research is focused on minoritized identities and their influence on mental health. She is especially interested in how experiences of trauma, race, body image, and weight stigma affect the well-being of children and adolescents, particularly in relation to the implications of culture, socioeconomic status, power privilege, and gendered societal expectations. Outside of work, Dr. Campbell enjoys cooking without recipes, consuming an absurd amount of podcasts, ocean paddling, and jigsaw puzzling. Welcome, Stephanie. Thank you for today's presentation. Our other presenter, Lydia Hogan, it's a quick disclaimer. She's under the weather a little bit, so talking and articulating things might be a little bit more difficult. And Stephanie will be talking a little bit more than I think as planned. But Lydia is a 5th-year doctoral student in clinical psychology from George Fox University in the rural town of Newberg, Oregon. She is completing her internship at the East Hawaii Family Guidance Center, where she has been able to live her passion of providing diagnostic clarity and treatment to under-resourced populations. Lydia uses her background in pharmacy and training on the assessment neuropsychology track in her program to conceptualize through a biological lens. She is fascinated by the intersection of medicine, spirituality, and mental health, and integrated those fields to create an effective burnout treatment for women. What started as a dissertation to fulfill graduation requirements has evolved into a personal passion. She is in the process of translating her research findings on burnout into a manual and book with the support of her dissertation chair. She plans to continue to provide workshops for women throughout her career. So without further ado, if we could welcome Stephanie and Lydia. So thank you. Thank you both very much.
Awesome. Thank you so much for the introduction. We are thrilled to be here to talk about From Empathy to Exhaustion, Recognizing and Addressing Burnout, Compassion, Fatigue, and Vicarious Trauma in Mental Health Practice. We'll have a quick introduction and activity, then go over some definitions, but we'll definitely spend the bulk of our time talking about prevention and intervention, practical strategies, and what to know. And then at the end, save about 15 to 20 minutes for some discussion, and have a lovely discussant with us, Christy, and some Q&A. If you have Q&A along the way, though, we do encourage you to drop it in the Q&A button in the Zoom bar. So as an introduction, you know who we are, but we're super glad to be here. And these are pretty much a standard guidelines for any of you who have been to prior trainings of mine. If people share their stories in the chat or anything, we encourage that stories stay and lessons leave. So just upholding mutual respect and trust. Care for yourself, because certain topics like talking about trauma can bring up emotions. So if you need a break, take one. Please do use the Q&A in the chat to engage. And the last is lengthy but important. Embrace conflict, discomfort, friction, imperfection, nuance, non-closure, and a both-and mentality. So this is our belief that multiple things can be true at once, and even if they're conflicting. So being able to embrace those multiple realities and imperfection won't always be comfortable, but is very important. What we will do is describe and define burnout, compassion, fatigue, and vicarious trauma. We'll offer suggestions rooted in recent empirical literature, and we will not be telling you to just do things to fix this. Not just take a vacation, or just have better boundaries, or just prioritize self-care, which I feel like many of us in helping professions have probably heard many times. So we're going to step away from some of that pop psychology advice and move into a different way to approach this. And I will say right now that much of this intellectual work and research and citations were Lydia's amazing work. It's in the area of her expertise. So even though the words might be mostly coming out of my mouth to save her throat and voice, it is a lot of her knowledge being put together here with some assistance from me. But we will start by taking an opportunity for a few minutes to do a quick self-assessment little inventory thing. So I'm going to drop some links in the chat. There are three basically subscales from the Copenhagen Burnout Inventory. You don't have to do all three. They're here if you want to. Well, make sure to when you post the webinar, we'll have a resource folder that we can send out to attendees that will include this in case you'd like to kind of assess yourself in the future. So please note that there are no clinical cutoff scores for this. It's really just a check-in to give yourself a chance to reflect and also provide a tool to monitor over time. So each of these only have about 6 or 7 questions on them, super easy. So if you just want to pick one that's calling to you, fill it out and just make a note of your own score and think about what you answered and how you were responding to those questions. It can be a good little start here. So we'll give you just a minute or two to pick one of those and do that. Forgot to have my background music pulled up for this activity. I like having background music. I could sing. That is a good point, Kimberly, but I will not. So hopefully you've had a chance to open at least one of those, quickly answer those 6 or 7 questions. Oh no, it says the personal link didn't work for someone. I'm so sorry to hear that. Oops, didn't mean to do that. It should look like this if you open it. I'm not super sure why that didn't work, but I'll drop another version in there. Okay, let me go back to here. Oopsie. Sorry, Lydia, do you want to take over for a second? I'm going to reshare my screen.
The Copenhagen Burnout Inventory is there's 3 domains, and I'll define them real quickly and then tell you kind of the point, what it means. The personal burnout means the degree of physical and psychological fatigue and exhaustion experienced by the person. So just like general tiredness. Work burnout is defined as physical and psychological fatigue and exhaustion that is perceived by the person as related to their work. And then the client burnout is the degree of burnout perceived by the person as related to their work with clients. Now, the thing about the CBI is like, it's not actually telling you which of these domains is contributing to your burnout. It's telling you which of those domains you think is contributing to your burnout. The scale is face valid, which means that the questions are measuring what they appear to measure. So like the questions are literally asking you like what they're measuring. It's not like a personality evaluation or some of those other measures that we do where you're not really sure what the score is going to be, where you don't really know the relation between your responses and the scores. And the authors of this measure, which is one of the most commonly used and has, I think, the best psychometric validity of the different burnout measures, they were getting at illness schema, which is like what we believe is contributing to our symptoms, contributes to our symptoms. So with burnout, we get into this place that we tend to have, we developed one of the definitions of burnout is developing this negative attitude towards our work or people we work with, thinking that they're the cause of our problems, which leads us to have a stronger stress response to those things, which leads us to deal with the burnout in avoidant ways, maybe like switching jobs, doing these things that the literature shows doesn't necessarily help in the long term. And instead of looking at ourselves as having the control and ability to change things in the way that we're responding to those hard things, we think that it's just like everything else is the problem, which prevents us from actually getting better. And, we're going to talk a lot today about like cognitive and emotional ways that we're relating to others and ourselves that can help us heal from burnout, besides just like drastically changing our environment.
Awesome. Thank you, Lydia. So there is a poll that should have popped up. So the 3 questions are what you're most familiar with, what you're least familiar with, and how burned out do you feel right now? So go ahead and take a second to answer those questions if you'd like. And then once that is, we have a pretty good number, Tristan can share the results with us to see. So now to get into what these 3 different things mean, burnout, compassion fatigue, and vicarious trauma, they do have a lot of overlap. I can see why people would be very confused, but we're going to hopefully disentangle some of that so you can understand which one might be contributing, because they have different suggestions on what will help. So to start, burnout is characterized by emotional exhaustion, depersonalization, and a reduced feeling of personal accomplishment. So this is work-related and develops as a result of general occupational stress. So it is not used to describe the effects of like indirect trauma exposure specifically. People in various different types of jobs can definitely feel burned out, but for some researchers, they are talking about it within the context of like a helping profession specifically. And, this exhaustion is really associated with reduced productivity, a lower quality of life, impaired physical health, loneliness, lowered self-esteem, marital conflict, job dissatisfaction, absenteeism, and a significant loss of like closeness and enjoyment in your personal and professional relationships. So you'll see that a theme through all of these is separation and disconnection in a way. Compassion fatigue defined is, I really love this version that Lydia has found. Oh, thanks for putting the results of the poll up. So it looks like people are generally familiar with all 3 or most familiar with burnout and least familiar maybe with vicarious trauma or same with all three. So a lot to learn. That's good to hear. And then people feel somewhat burned out on the whole more than the others. So thank you so much for sharing, and everyone can check out those results if you'd like. So compassion fatigue defined is the cost of caring for helpers. So it's a temporary state of exhaustion with an acute onset of work-related stress responses. And this is the idea that we just can't continue to pour from our, like some people say, like, from an empty cup or an empty bucket, right? We can't just endlessly care for others without also attending to our own needs. This is by far like much less specific and less well-defined in the literature than the other two terms we'll be talking about today. And it has been used to describe various things, including secondary traumatic stress. So this is importantly not an empirically validated or measured term as compared to the other two. It really lacks conceptual foundation. So that's why some of the suggestions we have on this one, it feels a little bit more, we're doing our best to suggest what we think would help instead of really knowing, because the literature is just not very robust. And the last one here is vicarious trauma. So this refers to changes in the inner experience of the therapist resulting from empathic engagement with a traumatized client. So essentially, when you hear and are exposed to other people's trauma, this is really a theoretical term that's not really necessarily about having the same kind of trauma symptoms, but it's this cognitive changes that kind of accumulate over time when you're exposed to a lot of other traumatic material or traumatic stress from others. So this primarily affects the professionals' like frame of reference in how they're able to think about trust, safety, control, esteem, and intimacy. And you might be wondering, if you're familiar with this term, how is this different from secondary traumatic stress? And there is a resource from the National Child Traumatic Stress Network we'll make sure to include, and a research we'll send out that has some great, like, we're really drawing a lot from that one and how they've compared it, because there are so many different definitions for some of these things. And they really define secondary traumatic stress as the presence of PTSD symptoms when you're exposed to that indirect traumatic material. So vicarious trauma instead is this more like cumulative cognitive change that happens rather than just having traumatic symptoms. So these definitions are a little overlapping. And so we have made a Venn diagram to try to make this very clear. In the very middle of this diagram, I think is like a really important big picture similarity between all three. I'm tired and I'm disconnected. And so that is really, can be said for all of them. You feel exhausted, you feel separate from others or from yourself in different ways. And so I won't necessarily go into all of these in detail, but I want to just point out some of the similarities between the different components. So between compassion fatigue and burnout, it's really work related and within the context of caring for others, right? Caring for others is exhausting. Cognitively, you have to listen and focus on the other person. There's also these cognitive demands of processing their symptoms, their needs. Maybe you're thinking about diagnoses. And then emotionally, really helping people through some of the toughest parts of their lives mean that we're exposed to just sad stories, unfair treatment, trauma, oppression, situations, like horrible things, any of that. And then we have our own emotional reactions that we have to deal with while also holding someone else's. And so that can be, really different from maybe you need to go to a birthday party after work, but you've just heard someone's entire life trauma in the hour before that. So you kind of have to like rapidly switch when you're a helping professional sometimes, which is tiring. It's just work. And then physically, both can kind of lead to feeling a bit fatigued. So let's see. The next comparison here between compassion fatigue and vicarious trauma, and we'll send the slides out so if you'll have this as a reference in general, but these two have less physical symptoms as compared to burnout. Specifically, cognitively, you're still dealing with people's suffering. And so really your mental health is very affected with both of these. And then vicarious trauma is unique from compassion fatigue in that it's really trauma specific, and it comes over time as things build up. And I guess compassion fatigue in a way can develop pretty quickly. You can kind of go from I'm doing all right to man, I'm super tired. So those are some of the differences there. Last kind of middle comparison here between burnout and vicarious trauma. They're the same in that there are schema changes. In other words, how we view the world can actually be altered when we're dealing with these two. And then emotionally, you can have like strong personal feelings related to helping others. So maybe we develop like negative views of others, or maybe we kind of get down on ourselves or the way we see ourselves. But they're also different in that, you know, burnout really can lead to that wanting to get away, right? Detach from others. This is described as depersonalization, whereas vicarious trauma can lead to like an over-identification with those trauma stories. So that's how they're a little bit different in that way. But cognitively, vicarious trauma, the schema changes are, you know, associated with PTSD and similar to that, and maybe, you know, feeling that the world is unsafe, whereas burnout really has those negative ways of looking at the world and self like more broadly than just the trauma symptoms. So just general negativity versus vicarious trauma can look like, you know, fear, jadedness, those types of cognitive symptoms that go along with the trauma. Anything that I missed or you'd like to add, Lydia?
Yeah, I think you did a really good job of describing those things and going over them. I think, yeah, they're all very similar, but there's those slight differences between them. And I think it's important to recognize which one more than the others is going on with us so we can address it appropriately.
Awesome. All right, so we will definitely spend most of our time talking about prevention and intervention things here. And we will spend a little bit more time on burnout than the other two for a couple of reasons. One, compassion fatigue just, again, is a kind of loosey-gooseier term, and that just has not as great specific suggestions on how to address it. And burnout is also the area that Lydia has done very deep research in, and so we have tons and tons of things to share about that. But first of all, disconnection, just like we talked about in the center of that Venn diagram, disconnection is a theme for all of them. So they're similar in that they cause us to feel disconnected from ourselves and from others. You know, burnout in that depersonalization and distance from those we're trying to help. Vicarious and compassion fatigue, we kind of have like a numbness towards helping or out of touch with what we really value, what's really important to us. It can feel like going through the motions or feel like it's automaticity. I'm zoning out. I'm just doing what I got to do to get through the day. And then distance from others psychologically, it can be a coping mechanism. It's important to protect ourselves from further stress, but it is also physiologically mediated. So that means, you know, it's not just your brain. It's going to stuff is happening in your body, and it's really important as well. When we're helping others who are suffering, struggling, or in pain, we are repeatedly exposed to, you know, we're experiencing distress from helping them, especially those of you who do direct work day in and day out. All day, every day, your body is, you know, starting to see those people essentially as a source of stress, right? Not because you don't care, not because there's anything, you know, broken or wrong with you as a professional. It is just what happens. We start to identify that as those others as a source of our stress. And when that happens, that's when our brains try to cope. That's some of that separation and depersonalization. And one of the most common ways to cope with that's one of the most common ways to cope with burnout, essentially, relating to others as objects, and we want to distance ourselves from that. Basically, try not to care too much because we're trying to protect ourselves. And it's hard to do this and also work effectively. So if you're trying to be a helper and you're like, oh no, my brain suddenly sees you as an object I must get away from, that means that we can't be the most effective helpers we can be. It's not because we're trying to objectify someone or anything. It's just that we see them and it's a stressor almost. And that leads to more burnout. But all three of them, burnout, compassion, fatigue, vicarious trauma, they can all be prevented and treated by being extremely intentional and aware of the way that we're connecting with others that we're helping, and also the connections we have with our inner experiences as a professional, which sometimes is a lot to ask, because I can tell you right now, right, you learn so much when you're going through your training to what to do and how to do it in ethics and all these things, but you're not necessarily taught in a deep way, like, how am I internally checking in with myself along the way, minute to minute, day to day? And so one thing is empathy versus compassion. If you'd like, if you have a thought about this, please feel free to drop in the chat. How are these, what's the difference? How are they different between each other? I'll give you a second if anyone wants to type something in. Both of these, though, how they're the same is that we talk a lot about it. We talk a lot about, you got to have empathy, we got to have compassion. Those are part of our training as helpers and helping professionals. But we're not necessarily super differentiating what the role each plays as part of our job. So someone says understanding, feeling for versus feeling with. Thanks for those contributions. There's also the confusing part that this is a lot of definitions within just these two terms. There are multiple types of empathy. That's one thing I know I was not taught in grad school. And with all these kind of different definitions swirling around and different understandings, we just want to note that we'll be using definitions the way they are discussed in cognitive psychology and more in the research field. So more of a brain science approach rather than, I don't know, like kind of a surface level or pop whatever understanding, because that can be so different and so varied. So it's been a little bit more operationalized within a research space. So just know that it is determined differently by different people, and that's something to keep in mind. Beyond just disconnection is the word I'm looking for. Beyond disconnection, emotion sharing is another major theme for all of these things. The following model is one by Lydia and colleagues, and it's a great, it's made for burnout, but it's very consistent with the research on vicarious trauma.
Yeah, so I like some of the comments people are putting in the chat. It's like pretty accurate based on what we're going to talk about. So this model is temporally accurate, which means it's basically accurate based on what's happening in time in our brains when we're in a social situation and we're sitting with someone else who is suffering. The first thing that happens before we get into compassion, before we get into empathy, is we have something called emotional contagion, which is also known as affective empathy. So emotional contagion or feeling/affective empathy. And this is, everyone experiences this, no matter how good of a person you are, how kind of a person you are. It's just how our brains are wired, the social emotional perception part. We automatically tend to pick up on the moods and emotions of other people around us. And this is a really quick, really short stage. It doesn't really involve thinking. It's just really quickly how our brains react to others suffering around us, or even experiencing other emotions could be positive as well. There's no long-term consequences to our body in this stage. And it's also important that when we catch those emotions, they're like less strong than if we generated them ourselves. And so then this is the next step. So this is when our executive functioning, our thinking mind, like kind of registers, like what's going on with this person in front of us? Why am I feeling that twinge of sadness? Why am I having this experience? It's like a top-down appraisal, an interpretation of our own response to the person, an interpretation of their situation. This is where we think about the context of their suffering, analyze the situation. And this is also considered the same thing as like mentalizing in theory of mind, which is attributing mental states to others, where we're thinking about what is that other person thinking. And this is considered the cognitive component of empathy and compassion. And it's, really helpful and protective against burnout. We find it's associated with brain areas that are important for self-other distinction, which is our ability to differentiate our own thoughts and feelings from the person in front of us. So this is really important to think, cognitively activate those executive networks about their circumstances. It protects us against burnout. It helps the other person understand we care. We tend to do this in our work, I would say probably a lot. It can be improved, the cognitive empathy ability with mindfulness, CBT, and it's negatively, like inversely associated with burnout. So the more of this we show, it tends to protect us against burnout, and we have less burnout symptoms. And then from that middle stage, that cognitive empathy, again, this is like in time, what is happening. We can either go to compassion, or we can go to personal distress. So compassion is, it is really helpful and healthy for us. It leads to better patient outcomes in helping professions. It is concern for and deep caring for someone in pain, which is similar to some of what you guys said in the chat. It's characterized by positive, other-oriented feelings like love, or we're feeling something different. So our nervous system is in a different state than the person who is in front of us. We're feeling different emotions. We're having different bodily responses, different cognitive and emotional responses. When we're in a state of compassion, we really want to understand someone's pain and we want to help them. It tends to be something that we have to try to do. Some of us, it's more natural, but it tends to be like a cognitive, like a purposeful choice to show compassion. It also inspires us to help somebody, inspires us to alleviate suffering, whether that's through the emotional support we're providing or other means. And the most important part for burnout is that boundary between myself and the other person is maintained. And we're actually activating areas of our brain involved in social connection, caring with compassion. There's beneficial health effects too. It reduces that sympathetic threat and stress reaction that goes on where our body gets all amped up when we're stressed. And it also biologically, it releases bonding hormones, it releases oxytocin and some other hormones, which helps us be a better helper. Because when we're showing compassion, our body is like, yeah, like I want to connect with this person. I want to move towards them and help them, which is the opposite of the other type of stress that we can get into. Well, not type of stress, the other type of emotion sharing. So from cognitive empathy, after our brain figures out what's going on in the situation, we can go down towards self-oriented empathy, also known as personal distress. This one tends to be opposite of compassion. You're probably not in both of them at the same time. It's kind of like emotions quickly change, but this is where we are personally feeling their emotions ourselves, as if we were in their situation. And this is, a lot of times we're taught to do this as providers. It's like putting yourself in someone else's shoes and sharing emotions with them. We may be applying their situation to our own life as well. So maybe if we're with somebody who's like partner passed away, we're imagining if that happened to us and like, oh, that'd be so awful. And this is natural, this is normal, this is natural, and it is part of being a caring provider. And if we stay here, it leads to burnout. So as best as we can, we want to try to transition from this self-oriented empathy is what it's called in the research. If you want to do more reading on it, self-oriented empathy, also known as personal distress, feeling empathy. If we stay here for too long, we're actually activating in our brain centers. Research shows like the same pain levels, like the same activation as the person that we're helping. And so that's going to keep flooding our body with the stress hormones like Stephanie was talking about, and really exacerbate and contribute to burnout. So as much as we can, we want to try to notice where we're at in this model. We want to try to notice where we're at, take stock, like, where am I cognitively when I'm with this patient, this person I'm helping? And as best we can, we want to try to stay as much in compassion as we can and catch ourselves when we're feeling intense emotions along with the person we're helping. Maybe if we're over identifying a little bit, especially like we'll talk about with vicarious trauma, it can be easy to over identify as well. And you can see with burnout, the answer, it's not disconnection. So we don't want to like create a shield to protect ourselves. We just want to connect with them in a different way. So connect with them when we're in like a stable place, we're like solid, we're feeling warm love and care, versus, you know, if that other person's really distressed, distraught, and we're just feeling that with them, it's not actually going to contribute to as good of patient outcomes in the long run if we stay there for too long, and it's going to contribute to our own burnout. So again, it's not all or nothing. All of these things are going to happen in our bodies and minds. It's about trying as best we can to stay more in compassion. So yeah, I don't know if anybody has any questions, or we can kind of go on to start talking about compassion, satisfaction. Maybe we can do questions at the end, discussion at the end.
Awesome. Thanks, Lydia. All right. So speaking of compassion, there is another idea here that's called compassion satisfaction. And this really refers to emotional satisfaction, like joy or pleasure derived from helping others. And I think a lot of the compassion, fatigue, and satisfaction research that I was finding is, I think, a lot with nursing profession. It's not exclusive to nursing, but it seems like more research has been done in that area. And so this is, you know, positive feeling that you can do well in social relationships, including relationship with your colleague, and can be considered an emotional state that actually helps to mitigate secondary traumatic stress. So it can, if you're helping people who have been through trauma and that's going well, you're getting a lot of like fulfillment essentially from doing that. Compassion satisfaction is the term that people have come up with there. And it's been inversely related to burnout and compassion fatigue. So basically, if you have more compassion satisfaction, more likely to have less burnout and less compassion fatigue. Showing compassion in itself, just what Lydia was talking about, staying in compassion and showing compassion, that in itself does not lead to compassion fatigue. Compassion is protective. Compassion fatigue has more to do with the temporary drain of the stressors of your work environment. And so what this can do is reduce burnout, compassion fatigue, and vicarious trauma. So if we can find ways that, and this is going to connect really well to when we talk about like our values. It's interesting because we say that these three terms have a lot to do with disconnection, driving disconnection. You're feeling tired, you're feeling fatigued, exhausted, and disconnected. And so many of the things that we're suggesting as a way to prevent and intervene has to do with different types of connection. How do we connect to what's important to me? How do I connect with myself and my body and my thoughts? How do I connect with people around me, right? It's connecting ourselves to our values. Connection really can be the antidote, right, to some of that disconnection in different ways. And
yeah, so just like quickly, some of how we can address that disconnection with ourselves, and some of the reason why we have that symptom when we have burnout is basically with burnout, we spend more time in this brain area that's associated with zoning out, not really paying attention to stuff. Our mind is wandering. That same brain state is associated with a lot of negative or undesirable states like rumination with depression and anxiety, lower cognitive performance. It's basically when we're thinking about nothing and our brain is just kind of going. And that's the opposite of being in the flow state when we're in work. I don't know how familiar you all are with the flow state. It's basically, we are just like so in the zone. We're working. We don't know what time it is. We're just like feeling the work. And if we're in this default mode network, we're not going to be able to get in the flow state. And one of the reasons why mindfulness is like such a huge thing, and everybody's like mindfulness. Some of the science behind that is that it actually reduces default mode network activity right after mindfulness practice in the long term. So it improves our ability to focus on tasks, to be in tune with our own thoughts and emotions instead of kind of disconnected and zoned out from the present moment. So one of the reasons why mindfulness helps with burnout is it helps us connect more with ourselves. With burnout, it causes us a lot of times, like Stephanie said, just to just kind of disconnect from ourselves, from others. It's part of the ICD definition of burnout. And so to reconnect, we want to use mindfulness. And I think it helps a little bit to conceptualize kind of like what we're trying to achieve with that.
Right. And so thinking about if we're disconnected with ourselves, there's another great couple of things to know about this. When you're doing work that is incongruent, it's not aligned with the things that you value, that can actually lead to more burnout. And very relatedly, if you are out of touch with your own values, you're like, I don't even know, that's actually a symptom of burnout, of not knowing what our values are. So we are going to do a couple of activities, but first let me give you this slide, I suppose. So how do we fix this? How do we not fix necessarily? How do we improve this? How do we reduce burnout through this? Values work, connecting with our values, aligning with our values can actually reduce burnout. And one way we can do this is something called a values card sort activity. So I'm going to drop something in the chat, and I'll also open it on my side so you can see it. Something will pop up. It says Google Drawings, copy document. Go ahead and push make a copy. If you're on mobile, you're probably not gonna be able to do this very easily, so don't worry about it. We'll provide it in the resources. You can do it later. But what I will do is show you what some of the terms are. So you'll still be able to think about values even if you can't really do this whole activity. And we're also not going to spend the time to sort every single word because that's just a bit time consuming. But we will spend a little time to at least let you think through some of these, and I'll lead you to it. So here's what you do if you're doing the full exercise. What you would do is take every single little item or card. We'll also provide this in PDF. So if you wanted to just print it and cut it out, that's very easy to do as well. And on this is your own copy, so you're not going to change anyone else's. You just take the card and you move it to what's important to you. So thinking about, for example, you go one by one. Achievement, I would say it's not important to me, but it's not very important to me. For me, it would go in important to me. So if you're doing the whole exercise, you'd go ahead and sort every single word into a category of not important to you, important to me, or very important to me. I'm going to go ahead and give you a couple minutes to look these over. I might actually bring up a PDF where it'll be easier to view the definitions. And if you have other values that come to mind, this is not an exhaustive list by any means, so you can always type in your own. We put a little box down here, other value that you want to, put in for yourself that's really important to you. But I'll tell you right now your goal. If you have time to start sorting, you can go ahead and just give it a go. Otherwise, I just want you to look through the values and think about what are some what's my top 5? What are 5 values to me that are very important, that I align with closely, that really give me purpose and meaning and fulfillment, the things that really define what's meaningful in my personal life or for my family or whatever context it is. So let me give you a few minutes to do that. And I will try to bring up the PDF. I'm not sure actually which one's going to be easier to read, so I'll just drop a link in the chat for that one as well. If you have any questions, please type in the chat and let us know. Moment. Okay. In this document that, oops, so sorry. In this document that we will make available to you for later, just note that the ones that are in gray are the ones that we kept on the list, but we took off of the digital version just because there's not a ton of space and we had to make some decisions. But you know, no one is constrained to just the items on this list. Of course, any value that's meaningful for you, you can definitely write down. And maybe there are terms in other languages that feel like a better fit than what we have in English, and some from Hawaiian.
Stephanie, I'm just noticing in the chat that some people said the link's not loading. Do you mind putting it back in?
Yeah. Let me try one more thing. Give me a minute. Thanks for letting me know. Got a lot of screens open today. Okay, here is another. This is like, should be the same link. I'm not sure. Yeah, so I understand that not everyone can log into that. That's why we want to make the PDF available too. So let me go ahead and drop the PDF in, because you should be able to just view that PDF regardless. And then you can just like look at the values and think through your top 5. Just make a note or make a little list to yourself. And I know many of them are going to feel important and be important. That's okay. It's really hard to narrow down your values. It's not necessarily an easy activity for many folks, because it's like, oh, many of these things are important to me. Let me just drop this PDF active version in here. Okay. So that one should just be viewable. You don't have to have any kind of Google anything for that one. Oh, my apologies. Yeah, you can't actually, sorry, this is not on one handy page. So I can also just slowly go down. Not sure why it won't let me share Snap. This time I was ready with background music, but I don't have the option to do it. Okay, and I'm sorry for those of you who aren't able to open it. You can look on the screen and you should be able to see the words on the screen. Or you can just think through, what are the values that come to mind for me? You don't have to always go off the list either. What are the things that I think are most important? What's nice about the values card sort activity is that it really makes you make some concrete decisions, right? You're like, you look at a word and it's like, where do I categorize this for me? So it's a little bit more clear, and it might have you think of words that you wouldn't otherwise think of, but it's not absolutely necessary to think about your values in this way. It's just an activity to do so as like, yeah, a reflection for sure. And someone try to get many times, I've done this many times, and you know what, folks get real tricksy with it. They're like, I'm going to hyphenate some words. I'm going to go ahead and sneak more words into my top 5. Really try to pick a top 5. It's a challenge. All right. And I know that this is definitely not enough time to sort your cards, but I'm hoping you at least have 3 to 5 values you've identified as very important to you. So now I'm going to give you more of a challenge. So I'm assuming everyone has 5 written down. From your 5, we're going to go ahead and cut 2 of them. You're going on a trip and your suitcase can only fit 3 of those values. I'm so sorry. We have to leave 2 behind. Now you have your top 3 values. So go ahead and mark off 2 so that you only have 3 you're looking at. Awesome. And so now that you have your 3, try to put them in an order if you can. If I had to put I'm allowing you to keep your 3. It's okay to keep your 3. Sometimes I really make people get down to 1, but then makes people get mad at me too. So go ahead and just order your 3, 1, 2, and 3. What is really meaningful to me in my life? What are the values that are most meaningful in what order? Thanks for sharing in the chat. This is really fun to see everyone's values. Definitely not required, but if you would like to drop it in the chat to share, that's great. Okay. So now that you have your top 3 values here, go ahead and do a quick follow-up activity to this. We just did our values card sort, or a reduced version of it, of course. Now I'm going to invite you to just settle in, get comfortable. It's a webinar, so none of the panelists or hosts can even see you. But we're going to do a quick values-based meditation that Lydia has written for us. This is a great thing that I know it's awesome to use even for yourself, or you can use it with your clients or patients. But go ahead and start by getting comfortable where you're seated or lying down or whatever you're doing. Close your eyes if you feel comfortable, or fix on a center point, some kind of something you can stare at. And take a deep breath in for 4 seconds. Hold it at the top for 7 seconds. And now breathe out for 8 seconds. So you can use that, or if you have another rhythm you prefer, you can do that. Maybe some people like the box breathing of in for 4, hold for 4, out for 4. But I would encourage you to either do that or to just breathe out longer than you're breathing in if you don't feel like counting. So continue that deep breathing pattern and notice your body, where you're pressed against your seat or other surface, feeling your feet on the ground. And start at your feet wherever they are and notice the sensations in your body. Stay on one body part for a full breath cycle before moving up to the next part of your body. And when you get to the top, continue that breath cycle and fill your mind with that identified value. What was that number 1 value that we just figured out? That thing that you care deeply about, the thing that maybe drives you or fills you with motivation or purpose. Think about that value, let it fill your mind. And notice the emotions, thoughts, and feelings you have around that value. Keep your breath cycle going while you observe, and stay here for a few cycles before moving on. Now try to feel that passion, that care, that value in your body. Where do you feel it? Is it in your forehead, your chest? What color is it? Go ahead and do a couple more breath cycles. Notice where you're connected to the ground, your body with your seat. And just immerse yourself in this moment where you are right now, embodying this value. Continue breathing and imagine yourself going throughout your daily life, feeling this grounded and connected within your body and connected to this value, embodying that value that you care deeply about. And when you're ready, go ahead and take one more deep breath, and you can open your eyes. Now you can try to carry that value with you throughout the rest of the day and maybe return to it more easily by remembering how that felt in your body. How did that value show up for you inside of yourself? All right. Thanks for participating, everyone. Go ahead and finish up our prevention and intervention tips before our discussion. This one is one definitely that I care a lot about. If you've come to some of my other trainings, I think shame is such an interesting and important experience for us to wrestle with in a variety of contexts. But I think especially when we think about our own work and how shame might show up or not, this is kind of a cycle of how burnout and shame interact. So in this cycle, when we're feeling kind of burnt out, we then get reduced productivity. We're less productive. We can't get as much done. And we also have reduced self-efficacy. We don't really believe in our ability to get that stuff done, to accomplish something. We start to have self-doubt. And that might lead to shame. Oh, like I'm feelings of I'm not good enough. I beat myself up a little bit. I believe in myself less. I'm ashamed that I'm not doing the things I said I would do or that I know I can do. And that actually leads to more burnout and more disconnection, which, feeds this cycle and it keeps going. So to counter this, some of the suggestions of using self-compassion and these ways to mindfully let things go, essentially. How do we let go these feelings of these negative self-talk, the feelings of shame, and those negative evaluations of ourselves? It's much easier said than done, for sure. But thinking about self-compassion and self-kindness, how can I be as kind to myself as I am for the people that I care about? Which is a challenge. I feel like there's so many of us helping professionals. I know for me and my colleagues and my good friends, we're just like, oh, well, it's true for you, but not for me. You know what I mean? Like they're going to help us and give us really good advice as a friend or as a colleague, but not necessarily be doing the same thing for yourself. And I'm for sure guilty of that as well. But when we can break out of this cycle, we can be more productive, we can believe in ourselves more, and we can protect ourselves from burnout when we're less in this state of shame and negative evaluation. And so we talked a lot about burnout, but I want to switch here to vicarious trauma. And here are just some risk factors for this. So it's good to be aware of what increases the risk for experiencing vicarious trauma. One is empathic engagement with others recounting trauma. So like Lydia was mentioning in that emotion sharing model, it's kind of how some of us are taught, right? To be in that moment, to share that with them, with whoever you're working with. And to a degree, it's important to recognize and share space in that connection. But if we're overly sharing, we're overly identifying with it, that can actually lead us towards experiencing vicarious trauma. So the other risk factor that's important here is unregulated personal emotional response to that person's trauma. And that could be for a number of reasons, including your own personal trauma experiences. I co-train some suicide prevention stuff, and my co-trainer mentions in our trainings how she had to take some time away from doing those trainings and working with folks and talking about suicide at all after being a survivor of someone, who had died by suicide. And I think that's it's so responsible to care for yourself in that way and to understand whatever trauma I've gone through is not going to just be totally compartmentalized and left behind, right? I can't totally separate myself from that. I have to understand how that might be interacting or coming into play with my work with someone else who has experienced trauma. So as you can imagine, this requires some reflection, just self-check-in. How can we more readily see how we're reacting, which is part of the next steps. So Lydia, did you want to cover this? Checking on your voice levels. Okay.
And talk about it. So it's really, like some of you said in the chat, this idea of increasing self-awareness. We really want to recognize, like, how am I responding to my client's trauma, to the stories, to the things that I'm hearing. And you can practice this, like in the therapy room. It's important to be aware of this, but we really do need to practice it outside of the therapy room in order to, kind of effectively deal with it in the therapy room. So you can do it with like imaginal exposure where you're like imagining yourself in that situation. It's probably the best state to be in when you're practicing at home. And think about, like a client who affected you recently, and really just, let yourself feel those emotions and then notice like in your body, where are you feeling those emotions? And then with vicarious trauma, one of the key things is, does this relate to my own trauma? Is this triggering me to think of my past trauma? Maybe not, just being aware and investigating that. And then we want to try to then, as best we can, kind of just like let go of that pain we're experiencing, those emotions we're experiencing, our thoughts, our emotions, our own response, and transition to a state of compassion, where we are focusing now on motivation to help that other person. We're feeling like concern, care, love for them. So we can practice doing this like cognitively on our own. It's a cognitive and emotional exercise. We have to practice from going to being like in the depths of our own feelings in response to focusing as much as we can on helping the other person and transitioning to a state of compassion where we're feeling something different than the person who is struggling. So we can practice that at home, and we can also practice it in the therapy room. It's a good idea to have reminders to ourselves. I've done this before. We have like sticky notes to yourself. Just remember, like, C for compassion, or notice, like, what am I feeling right now? So we really, as best we can, want to just be aware of our responses to others' trauma. And it's not enough to do that just in the therapy room. We have to do that outside of the therapy room, and it uses that cognitive and thinking empathy. That middle stage in the model is really the key to get us into compassion, to transition from like, oh, I'm feeling those strong emotions with them. Now I want to transition to being more of a helper, more you're a helper when you're feeling their emotions, but more of the stable rock in the situation. You're stable with your nervous system. You could be feeling other things too. It doesn't just need to be warm love and care. It could be like anger that they're suffering, could be like confusion, other things, but warm love and care tends to be the most common emotional state with compassion. And that helps us get into vicarious post-traumatic growth that Stephanie's gonna talk about. It's not all bad news.
Yes, we want to have lots and lots of hope for sure. Working with folks, especially who have experienced trauma, that requires a lot of us. We already talked about earlier how it's a lot just to listen and be there for folks in general. And then when you layer these experiences of trauma and trauma survivors, that's a whole lot to handle. And so, professionals working with trauma survivors can experience growth within themselves as a result of like witnessing their clients' resilience and ability to overcome that adversity or the situation, being able to heal from trauma. And so that it suggests that this, vicarious phenomenon can be positive and powerful as well. And this is a quote from an article here. Over 70% of trauma counselors report living life more fully, treating others with greater kindness, or becoming more expressive emotionally within their personal lives as a result of their work with trauma. I don't think that happens automatically, right? There are many times where, for sure, if we have no space for our own processing, we have no space for our own understanding of what trauma does and is, that can be really tough. I think we can definitely have either vicarious trauma or that secondary traumatic stress that can definitely come into play. And that's why I think there's a lot of folks, thinking about it, writing about it, talking about it. But when we are able to have the more focus on the growth and what we can overcome, the resilience part of this. There's lots of personal and professional benefits as listed here, right? Compassion, sensitivity and insight, appreciation for different spiritual paths, job satisfaction and self-competence, and personal self-actualization. And one thing, I didn't really put this in the slide, but I think this aligns quite nicely with some of the definitions that were put forth by the Trauma Informed Care Task Force in Hawaii. So for those of you who might have attended our recent webinars in April and May, we talked a lot about the resource recommendation packet that they put out. It's Googleable, anyone can find it, but they really focus on, it can't just be talking and knowing about trauma. We really got to have this other piece of resilience and the strengths that we can focus on and grow and nurture, as well as understanding the what trauma does and its negative impact. It's got to have both to really be holistic and to understand that for communities that have been through significant trauma, like the one that I'm, currently living and working with, this is important to understand the protective factors, the resilience, the strengths that can come with having been through these impossibly difficult situations. Anything to add, Lydia, to vicarious post-traumatic growth?
Yeah, I love that. I think it's just emphasizing that even though I feel like we always just hear the negative, oh, you're doing this.
Doing our own work there in our own therapy or our own supervision, taking time to process it outside of the workspace as needed, of course, and then making space for emotions, extending self-compassion. And then here's some just questions you can think about, right? Like, what meaning do I find in helping others? It's getting at that meaning and value connection. How do I appreciate things differently now? How have I grown from helping others? How does this work relate to who I am as a person, which you can also connect to back to your values. And then addressing compassion fatigue. So this one is the one I mentioned, a little loosey-goosey, a little less robust, but we still think this is probably really solid suggestions. So if this is the cost of caring, we have to be able to pay that cost essentially. And we have to find ways to fill our own buckets, to fill our own cups, to then help others. So again, as a reminder, this does not come from just showing compassion. We don't run out of compassion and grow tired. It's from a stressful environment. It's from not having sufficient boundaries. It's that really causes it, not just the act of showing compassion, for sure. So a lot of the advice in some of the literature, well, it's broad and not very focused, but some of it is being aware of it, identifying your current ability to care for yourself, what things are maybe problematic thinking and behavioral patterns, that kind of thing. But essentially, how do we find ways to fill our buckets or fill our cups? It has to do with caring for ourselves. And I am a big fan, and I conceptualize it like this. And honestly, for me personally, this was much more motivating to me to conceptualize it as an act of resistance. And I did not think about it that way until a few years ago. How is caring for yourself radical and political? Anyone have ideas? Please drop them in the chat. If not, I'll tell you what I think in a few seconds. One important thing here too is that a lot of this great work about this being radical and political have come from Black, Indigenous, people of color, especially women of color. So there's a quote from Yvette Dion, who said, "Black women are often the pillars of their community. Literally, we're tasked with taking care of everybody in our families, taking care of who are not in our families but are in our villages. We're often given the messaging that taking care of ourselves is selfish, and that's putting ourselves first, takes away from our community." That is this conception of it, right? When you're kind of the pillar of something. I think here, especially in Hawaii, there's such a, you have your kuleana to your people, your community, your town, your family, and that can feel like you're taking away if you're taking care of yourself. We have to understand, this is a great quote against this, is that caring for myself is not self-indulgence. It is self-preservation, and that is an act of political warfare. And if you're unfamiliar with Audre Lorde is defines herself as a Black lesbian mother warrior poet, and just has beautiful words about all of this. But I think it's so important to remember that it's not just the case for people with minoritized identities. We can fall into that no matter what your background is. It just also has these extra layers of challenge sometimes when you're also having to deal with systemic oppression. So holding that and caring for ourselves and making that priority for ourselves is an act of resistance, right? It's a struggle to be out here in this year 2024 in the United States. It is plenty going on to make it hard for us, and we don't have to make it a competition of oppressions. We don't have to compare ourselves to everyone else. But I think ultimately we have to understand, what is it that I need to rest and to care for myself in order to care for others or to help others. And so this is my picture of this. I'm a big fan of just writing it like this because it's resistance. It's rest is resistance, encapsulated in one little word. I have considered giving this as a tattoo. I'm not sure if I will, but I'm thinking about it. I just care a lot about it. I think rest is something I didn't prioritize enough in my earlier life, and now I think it is absolutely essential. And so as a last little tip here for wellness and caring for yourself, which I'll take a note from Joe B and talk that caring for yourself and self-care are not the same thing. So I like to think about it as caring for myself, just as I would care for others. It means more to someone who maybe has struggled with self-care in the past to think about it as caring for myself, or that self-preservation. You can think about all the ways we can be well. And this is just one example. It doesn't mean there are only 8, but it's a way to think about not just my physical health. Am I sleeping? Am I eating? But am I, socially healthy? Do I have a spiritual practice that means something to me? Am I emotionally sound and stable? Is my environment pleasant and supporting well-being? There's just all these ways we can think of wellness, and it's important to honor and think about all of them. So just as a summary of some of the things we said as a practical steps, we need to pay attention to how we are showing up with our clients, with ourselves. We need to pay attention to how we react to our own act of helping. We need to practice compassion and, very importantly, self-compassion. A mindfulness practice, of whatever way that makes sense for you, can be extremely beneficial. For example, having a values-based meditation. And understanding the role of shame is so important, as well as deeper cognitive self-work, which we need to point out can be a real barrier to getting help, right? Lots of helping professionals have trouble because it's not something quick, it's not something easy, it's not something we can just do. But really taking time to do that deeper self-work can be super beneficial. All right, that is all of our content, and we can transition to discussion time.
Great, thank you very much. So now I'd like to introduce 2 special guests on top of our already full slate of special guests. First, Christy Ortiz was born in the small town of Waiohinu on the island of Hawaii, and she now lives in Makiki, Oahu. She graduated with her BS at the University of Hawaii West Oahu in 2022 and first started out as an assistant with DHS, working closely alongside social workers. In 2022, she became a permanent human services professional 3 and was recently promoted to her current role as a child adult protective services specialist with DHS. On her free time, she enjoys being with her family, sitting and watching movies, shopping, and spending time at the beach. So she will be one of our 2 discussants. Our second is Farah Canyonero. Sorry, Farah, I'm doing my best to pronounce your name. Please correct me if I'm wrong. Just unmute yourself in a bit.
It's okay. You're good.
Thank you for your patience. She is a DHS case manager in the Social Services Unit 1, Diane Pana's unit, where she has worked for almost a year. Prior to being in Diane's unit, she served in the West unit as an assessment worker for 4 years. She noted that her reason for this change in position was to avoid burnout, as she has experienced personal loss during the last 2 years as an investigator. This change in position has helped her to be more present and available for her children, herself, and her family. So Farah and Christy, typically at this point in the roundtable, we turn it to our discussants who can take it in a variety of directions, ranging from usually maybe just giving some initial thoughts, feedback and comments on the presentation, and then we can kind of look at some of the question and answers. And we've been taking some notes on some of the things in the chat. So if it's okay with the two of you, would it be okay if we started with maybe your initial thoughts and reactions, comments to the presentation, and then we can get into Q&A? What do you think?
That's fine.
Thank
Yes,
you.
I'm okay.
Turning it to you too. Thank you.
I thought I really liked the presentation. You know, it was a good presentation, but for me, you know, it's like it's hard, you know, like just getting to that point of self-care is hard. And I think, you know, maybe we could use more examples of how to get there and like a step-by-step ways for us to get there, because some people don't know, you know, they think it's like, oh, it's so simple, but it's not. You know, myself, you know, have suffered burnout and vicarious trauma. And just getting to the point where I was able to set boundaries took a while and took a toll on me. But it took time for me to get there. A lot of self-doubt, a lot of, you know, don't think I can do it, you know, and for me, what helped me, you know, is support from my coworkers. We have an awesome supervisor, my coworkers and my family, but it took time. It took time. And I still sometimes feel myself falling backwards. So it's just maintaining, how do I maintain this mindfulness space every day? You know, when we see clients different almost every day. And Farah can, you know, extend, you know, on this, but we see different people every day. We deal with so many different types of emotions, and it's just hard, you know, maybe more steps.
So, piggybacking on Christy, it does take time, and it did take a lot of self-doubt. In my experience though, like, you know, when I was an investigator, it's hard to let go of, like, it's hard to let go. It was hard to let go being like leaving the position, you know, and accepting that and acknowledging that I was at the point of burnout. And as mentioned, you know, Brad mentioned that, like, he mentioned that I did, me and my children did suffer a loss. I lost my partner, their dad. But I wanted to, like, for me, it was like, I wanted to be the first responder to help other people. But then I had to step back and set the boundary and realized that I can't help other people if I was feeling burnout myself and I was going through the emotions. And like, when I would meet with clients, luckily I had a work partner with me, because there was a few times where I would just have to step away to prevent myself from breaking down in front of the client, because there was some kind of like transparency with feelings when they would talk about their loss or something that they were going through, and I could feel like their emotions. So eventually that's how I was able to set boundaries, recognize, and that's how I moved positions. I am at a better place. I do have a lot of support with my work, family, and my family and church. I do like a lot of spiritual stuff turned to my religion. So that helped me. But it's all about recognizing like your burnout and setting boundaries and getting help or making changes. And it is hard to make changes. It could be difficult to make changes right away.
Thank you, Christy. Thank you, Farah. Yeah, maybe Stephanie or Lydia and anybody else, the panel want to expand on that, respond. Just in the last 10 minutes, we're just kind of going through the Q&A. I see a lot of the Q&As have been answered. So just any kind of more free-flowing stuff to share, that'd be great. Lydia, Stephanie?
Yeah, I think that's just all over very good points of this is not easy or simple. I think that's part of why when you're thinking about this deeper work, this aligning with your values, it's not a quick fix, unfortunately. And that's we could spend a whole day training on figuring out how to get people through step one. I think of what's the first thing that I can do. So yeah, I appreciate your sharing your perspectives and stories. One thought I had is like that folks often miss out on, I think, is thinking about all the areas of wellness that we could be addressing. It's not just mental health and physical health. There's just so many other things that could be filling us up. And I know for me, a big one is community. Like, who are the people I have in my life who I know I can talk to, who will be there to support, who's gonna, bring you a casserole if you're sick or something happens, that's what comes to mind for me is like, it's going to be different for everybody on what's going to be important in that moment. But I think the first step, if I'm thinking about trainees or people who are fresh in their careers, of like investigating for myself, what reflection needs to happen to see which areas are more important for me in this moment, because it might not be super equal all the time, and we might need different things at different times.
I agree.
Yeah.
Completely agree. And then you like, so when you person first starts a job like what we do, they're ashamed to say they're burnt out. They don't know what step to take, so they don't do it. They keep doing it until the shame goes away or until they feel like, oh, I can't. And they just snap, unfortunately. They have a breakdown, which has happened,
And there were so many things that you both said that I think are a help in a session. You're in, you want to help others, and so when you feel like, helping yourself and to take care of yourself can be really hard. And I think having supportive coworkers is something that's helped me a lot, because that okay, it's okay to not being here to help benefit me. And I try to do that for my coworkers too. But again, you kind of get stuck in the cycle of how helping everybody it makes it hard to help yourself too. But I think that just giving yourself permission to do some of these things, or to just take a break or take a day off, or take an hour off, is a start. Step in the right direction, but just giving yourself a little bit of time, and just that permission is the biggest thing for a lot of us, is that it's okay, and sometimes that's hard to do for yourself. So getting it from somebody else, giving and be something that for them, you can see it happening for them. And my boss is here, so I wanted to acknowledge that he has done that for me too. So that's good for me.
it's awesome that your boss could recognize that you were going through a burnout, because not all supervisors will recognize it, or if not, they will acknowledge it and talk about it. And sometimes the communication, or like the how it gets across communicated, it could be offending, or it could be like they're trying to be sincere but they're not, and they're not, there could be a miscommunication, dependent message gets. So that's good that you have that support and your supervisor was able to see that, and hoping that like in the future a lot of supervisors will be able to see their employees or recognize when their employees are burnt out and see how they can help them, and not just like approach them and like they have to watch how they approach them because they're already burnt out, so their feelings are going to get hurt easily, you know what I mean?
Yeah. What do you think was helpful for you, like as having a supervisor help you, or if you've had that, like what do you think was most helpful for you?
It wasn't so much the supervisor, but it was a lot of the coworkers, and it was people outside of my unit who helped, I guess, who helped reassure me that I was doing a good job and I was strong to come back to work after losing a loved one, and still continue to be an investigator and raise my 3 children by myself. So like, with all the support and encouragement, I was able to like reflect and then bounce back and then do better and then move on. So yeah.
Yeah, it's the supervisor, like Farah was saying, there's some supervisors who recognize it but don't know how to talk to the person about it. And then there's some supervisors that are understanding and who just knows, like if you need a day off, she'll always ask, how are you doing? Are you okay? Just those little things can help, and you don't see it a lot.
Yeah. And I'm seeing in the chat that there's a question about Employee Assistance Program, or EAP. I think you should use that anytime you feel like you need it. I mean, that's what it's there for, and I think it's super underutilized. I think because it's a little bit scary and intimidating, and again, like giving yourself permission, or am I gonna be weak? Even if you're a therapist, it's like, oh, I don't know if I can go to therapy, because then something's wrong if I'm going to therapy, and kind of admitting that can be hard. But I think I know that EAP is really underutilized, and so if you are even thinking about it, I would encourage you to use it. And if you decide you don't like it, it's fine. It's not a big deal. But might as well try it and see if it's something that could help you. That's my 2 cents on it.
Yeah. And I think a related question too, in terms of workplace, was someone asked about if something is, when admitting burnout is not well received, what do you do if you don't have a supportive environment when you should? My first thought is there something in the organization, especially if you're in a helping profession, people are going to have either like a mission statement, a values, a something. And is there something you can point to within the organization's policies and procedures or stated values that you can say, hey, we say we're going to care for our work, not in like a sassy way necessarily, but I think when we can point at a third place and a thing and say, hey, these are some of the stated things, here are some of my experiences or concerns, sometimes that can help a little bit if they have that. I know not all places will have that, but in general, it might be, it's hard to navigate. I think especially as a trainee, especially as an early career person who hasn't had a lot of experience and you're still getting supervision or whatever it is, can be really, really, really tricky to navigate. And so I'm wondering if there are colleagues or friends or someone who can maybe you can process that with first before trying to bring it into your workplace, if that's not going to be a good experience.
Thank you, everyone. Sorry to cut this short, but we're 1 minute out. Just wanted to end with a housekeeping announcement. Whichever email you use to register for today's roundtable, please be on the lookout for a feedback survey that we will be sending to you at that specific email address. If you've signed up to receive social work CEUs, the CEUs will be awarded based on both your time in today's webinar, at least 90%, as well as filling out that forthcoming survey. However, even if you did not sign up to receive CEUs, we'd be grateful for and appreciate any feedback you have in that survey. Please be on the lookout for that. Lastly, unfortunately, CEUs for psychologists were not available for today's roundtable. So thank you again to Stephanie, Lydia, Christy, and Farah, and Camdy, Jamie, Scott, Kurt for hosting another great roundtable. Thank you, everybody. Have a great day. Bye.